Hi, I'm Suppose. Welcome to the Net Hero podcast. This is our special edition of Big Zero Show briefing. Remember, the show takes place on the 2nd and 3rd of July at the Coventry Building Society Arena. Last few tickets going. And this topic is the one that affects all of us. It's all about the NHS and net zero. Hi, welcome to our Big Zero Show briefing, and one of the most important battlegrounds in the forthcoming election will be the NHS. But did you realise it's also one of the key areas when it comes to net zero? And we'll be talking about that at the show, and I'm delighted to say that Wendy Cheeseman, who's one of our speakers, who will be talking through what she's doing, particularly in the Oxfordshire region with Health Trusts, is joining me now for this briefing. Wendy, hello.
Hello, hi. Thank you for asking me on.
No, brilliant. What is your official title? Are you Sustainability Manager for Oxfordshire Trusts, or what would you call yourself?
I'm Head of Sustainability and Carbon Management for the Oxford University Hospitals NHS Foundation Trust.
How many hospitals are there?
There's 4 hospitals, and we've got a number of satellite sites as well. So there's 3 hospitals in Oxford and 1 in Banbury.
They're big, right? They're the
big.
hub of everything, and we all understand what the NHS does, and it saves our lives, and it does brilliant things. And their job is to save people and make them better. How difficult is it, before we talk about what you're doing, start to instill a thing about the other side of it, which is the emissions and the carbon? Because we've seen it with the pandemic. Before that, everyone's saying get rid of plastics, and how vital were plastics when it came to the issues of dealing with the coronavirus. So just trying to put it into sort of so people can understand, is it something that crosses the mind of the people who work in hospitals? Because as we talked about just then, their job is something far, you could say far more important.
I'm going to answer that with in 2 points. So the first is, if you're a healthcare professional, you're in a caring profession, and actually if you care about people, you invariably care about the environment as well, and the impact that has on people. So the biggest determinant of people's health is the environment in which they live. Well, everything we do about net zero comes back to the environment. So when you talk to staff, A, they can't stand waste, and B, they see things. They absolutely see things. So we have a very strong staff network, and I get emailed daily by many, many colleagues across the trust in all sorts of disciplines, all sorts of areas, saying, I'm seeing this, I'm seeing that. Can we do something different here? I work in a lab. Can we do something? I see this going on. Is that waste? Can we stop that? So often it's looking at reducing sort of our consumption of items, because it's a cost saving. It might be, they see it as waste, and also obviously the reduction in emissions as well. And we have a saying in the NHS, and we have a greener NHS central team, and it's lower emissions equal lower admissions.
I like that.
We absolutely understand that any decision we make today, all the activities we make today, pumping carbon into the environment, which is impacting on the health of our populations that we serve locally, nationally, and globally.
You have obviously looked at, what you said there about people. I never thought about that. I'll be honest with you. I just thought people would be so, because you get the image, and I know I've got friends that work in the NHS, and they are up against it, and they're stressed, and they've got so many things to do to keep us all safe. But what you're saying is quite interesting, that people have the time to bring this up to you, to say that they want to actively engage. I would have thought it'd be the other way around, that you're trying to push them, go, hey guys, I know you're really busy, but have you thought about cutting waste in the operating theatre or when you're doing tests? But you're saying it's the other way around.
Oh, it's absolutely the way around. We're pushing an absolutely wide open door. So there's many, many staff networks already, people who really want to galvanise action in their own areas. So we have greener theatres, and again, a lot of this is there's national support for these groups, and there's the groups talk to other NHS trusts as well, and we work within an integrated care system too. So we have the primary care trusts and like the doctor surgeries, supporting with the acute trusts such as ourselves. So there's an awful lot of working together, and that's a big difference from the public coming to the public sector from the private sector. So you're not having that intellectual property. There's a huge amount of collaboration. And I think the nature of particularly medical staff, they're perhaps moving around different trusts through part of their career.
Yeah.
So there's a lot of learning that's brought around. We did this at this hospital. We did that at that hospital. Can we bring that learning here? We have anaesthetists who are incredibly committed and passionate to reducing our use of fluorinated anaesthetic gases. We also have our NHS standard contract, and in there our service conditions also ask us to look at various aspects of the work that we undertake to make sure that it's as environmentally friendly as possible. But all of our staff are absolutely committed in some way or another to try and make a difference in their area. And as I said, there's different drivers. Sometimes actually the environmental benefit is perhaps a co-benefit from trying to reduce waste.
Understood.
And that's not just waste as in rubbish, it's waste as in, I think we're buying too many of those, or we buy those in packs of 3 and we only ever use 2, that kind of thing.
The NHS, I think you'll correct me, but it's huge, obviously. And the stats I have, 40% of public sector emissions come from the NHS. And I think you said globally, the health sector is 5%.
It's
Right.
4 to 5% globally.
So you think about that. People worry about aviation, right? If you ask people about planes, everyone's got an opinion about planes and, don't take flights and all that. I can't believe that we would think the same about our hospitals and our healthcare.
They're obviously incredibly energy intensive in the first instance. If you think about ventilation, think about heating, lighting, obviously controlled environments for infection control, etc., and obviously our patients' health. But they're incredibly energy intensive. You think about some of our the scans that we undertake as well. This is all the diagnostic work, which of course is increasing as well. So they're very energy intensive, and things like anaesthetic gases, so those fugitive emissions, we release a lot of anaesthetic gases into the environment. So a strong drive towards looking how to do that, to use more energy efficient.
It's incredible because what you're talking about, people would think about big corporates, right? And they think about all that, supply chains and all that. Maybe I'm wrong, but I never think that when I see a hospital. I just think, I don't think about it. Of course, now you say it, I see the steam coming out when I walk up to the hospital. I know there's loads of plastic that you use in the gloves and all of that, but I don't think about things like when you go under and the gases there and all of that.
Yeah.
Do you think there's a perception that we don't really, we see the NHS in a very different light to if it was another business, producing, and a business putting 40% of emissions for a sector would be like, oh my God, cut them down. But we don't see that with the NHS.
Oh, I think probably like you opened with, first and foremost, we think of it as a place to get care and access to healthcare. So that's perhaps our first thought. So it is sometimes, I think, a surprise to people that the NHS has these stringent net zero targets. We're looking to be net zero in the activities to which we control by 2040, in the sort of wider supply chain by 2045.
Wow.
There's some really difficult targets to achieve, and we must work together. And that's one thing the NHS are extremely good at, is working together, collaborating.
Of course.
Here's a waste policy at our trust, this worked for us, can you use it at your trust? Because actually we are all doing the same thing, and so there is lots of opportunities for us to standardize or share information, share learning, and share resources.
A couple of quick things I want to talk about before we go. One is supply chains. You're a massive employer, and people think of the doctors and nurses and people in the labs and catering staff, but you need stuff, and there are lots of smaller businesses as part of your supply chain. So is this another area that you're looking at to say, right, we're going to try and bring these people with us?
Oh, absolutely. I think, I can't remember the first or the second largest employer in the world. I know we're absolutely up there, the NHS, and obviously we have a massive spend, and we need to make sure that that is spent wisely, as you can imagine, but also in a way that doesn't increase climate change, etc. So things that we do in procurement. So if we have contract spends over a certain amount, we need our suppliers, or we request and require our suppliers to have carbon reduction plans and carbon reduction targets that absolutely mirror ours, because our scope 3 emissions are somebody else's scope 1 and 2 emissions. So if they're all working on their 1 and 2 emissions, our scope 3 emissions are going to come down, obviously, by the same amount. And we do have a lot of suppliers coming to us with innovative ideas and things that they'd like to do and trial. We had an electric lorry on site the other day. So suppliers are absolutely out there looking at how they can decarbonise what the activities that they do, whether it's delivering to us at site or the things that they provide us with.
And I suppose the other thing that I never think about is the medicines. Nearly all my medicines come in a plastic thing or a bottle and I was just doing the research before we chatted, and you think about the things that are direct, obviously the transport, the food, the heating, but that whole side of it, the medicines, that's a huge part of what brings up your carbon footprint, isn't it?
That's a really important point, because it's obviously we are in the production of medicines, there's lots and lots of different ingredients that are used that are sourced globally, and things like interruption to supply chains are incredibly important. And actually, as we look ahead to things like adaptation and resilience, that areas where there might be flooding, overheating, all these kind of things will impact on our supply chain potentially, which might impact on ability to source some of the supplies that we need. So it actually spreads across all aspects of what we do. All the implications of climate change will actually impact on the NHS in some way, shape or form, and we need to be prepared for it.
I think it's been fascinating. You'll be speaking at the show. Thank you very much for that. We're looking forward to your session. And I think there's a lot people can learn who are not, people who will think, oh, the NHS is a bit removed from us if you're in just general commerce. But it's lessons for business across the board, isn't it?
It is, and I'd say actually we're at the forefront of tackling climate change. So if you look at some of the regulations in place for large business, it's looking at scope 1 and 2 only, whereas we are looking and we have absolute targets to meet across all of our scopes in all of our activities.
Wendy, I can't wait to see your session. Thank you very much. We'll see you in July, seeing Wendy talking in our Pathway to Net Zero sessions taking place on the 2nd of July. Remember, you can get your last few tickets available now on the website. Go to Future Net Zero or the Big Zero Show. Wendy, look forward to seeing you in a couple of weeks' time.
Thank you so much.
You've just heard the Net Hero podcast from futurenetzero.com. Join us as we help you find ways to cut your carbon footprint as we head towards net zero. Subscribe and follow us on social media. futurenetzero.com. Better business, better planet.